Last 2 or 3 days, I've been interacting with many students who have given NEET PG this year and they have received their results. They have a lot of questions: which branch to join, where to join, what branch will I get at my rank, and there were some common threads, some common basic queries which they continuously asked. So I thought I'll make a small video over it. Whatever I'm going to talk in this video are my own personal opinions based on my own personal experiences of life. And if nothing else, they will provide you a perspective, to think and maybe decide better in choosing a seat. First, let's look at one of the most important fact. Probably if you're smart, just out of medical college, you would be 23, 24 years old. Even if you have dropped for 2-3 years, you would be some 27, 28 years old. Right now, what I want to say is, you have 40 years of work life. 40 years of work life as a doctor, as whatever specialty you choose at this point, you are going to serve in that specialty for next 40 years. This is huge. Why I want to bring and state this point to your attention? When we look life from year to year, day to day or month to month, makes a lot of difference. However, when we see the entire perspective of it, then we realize why I want you to focus on this important fact is when you see the life or the events in a year span. Like this year, what was your rank and what seat you are going to choose, and you're just choosing because you don't want to take another attempt. Things look very different, but when you look at a certain thing from a perspective of the entire life, the entire way to look at things change. Why this is critical is because whatever specialty or area of field you would go, you will spend the rest 40 years of your life into that field. Now, let's move to some of the very, very basic questions which people have been asking me. The first and the foremost is, what to prefer in a good college and a lesser like branch, or prefer the branch of your choice in a private college or even in a not so good college. Now again, the most important fact is 40 years you have to spend in that specialty. You better do it in the specialty of your choice. As far as college is concerned, yes, it matters which college you are from. It aids your learning. Obviously, someone from a very, very good institute will have a head start in terms of learning. But learning is a lifelong experience. So, if you choose the right specialty and if you keep learning in that specialty, ultimately, within a few years, from which college you have graduated or from which college you have done your post-graduation will stop mattering. So my recommendation at this point is, go take your preferred branch in any college you're getting. That's it, period. Because once you get through it, if you are passionate about that branch, if you like that branch, you can keep learning in that branch, and soon, you will do very well in I would like to quote a Forbes study that Fortune 500 companies, 95% of the CEOs are not from Ivy League colleges, which means 95% of the CEO of top 500 companies in the world are not from good institutions, good MBA institutions. They are not from Harvard, they are not from Oxford, they are not from Cambridge, they are from very, very average colleges. And the fact that 5% are from Ivy League does not mean that people from Ivy League become the CEOs. They become the CEOs because of a lot many other things rather than their college. A good surgeon may come from any medical college, right? So in total, don't be too much focused onto college, period. The next thing which people will ask me is MD, DNB diploma. Now, again, 40 years of work life. Obviously, an MD degree or an MS degree will give you a lot more confidence, will give you a lot more exposure. But if you feel that you have already given 2-3 attempts, if it's your first attempt and you are getting a DNB or a diploma, and you feel that you have it in you that next year you're going to crack MD or MS, you can get a seat in MD or MS, I think it's worth spending 1 or 2 attempts more. But if you feel that getting an MD or an MS next attempt is also not feasible, better to go for DNP or diploma. It's as simple as that. Again, the same principles apply. The learning will continue throughout your life, but the specialty you choose will remain throughout your life. So it doesn't matter. I know so many DNB and so many diploma holders who are awesome clinicians, very, very awesome clinicians. And many MDs, even they don't have, they have that knowledge, but they're not great clinicians. So again, MD, DNB, diploma, whatever it is, if you feel you can take another attempt for that, go for it, or choose the specialty of your choice. Now, the next is government or private college. Again, the same thing applies. Wherever you are getting the seat of your choice, wherever you are getting the specialty of your choice. One person asked me that, radiology in some private college, even though I will get, but the fees will be very high. Now, again, some person was saying that even though I may get a private college seat, but the fees will be very high. Now, the fees would be for 3 years would be to the tune of 24-25 lakhs. Now, the first thing is, are you capable of paying that much amount of money? If the answer is yes, then I think you should pay that fees. Why? You have to understand here. If you are getting a specialty of your choice, then within 1 year of your earning, you will be able to pay off that fees. If it's very high, you are not able to pay, then the matter is closed there and then. But if you are able to pay, and just because someone has asked this question, which means they are not very confident that next year they may get a good seat otherwise also. So I suggest, if you are able to pay the private college fees, you are getting a branch of your side. It's better to join a college, even a private college, pay the fees, get into the real practice as soon as possible. Because the earlier you start your practice, you will have more time at your hand. You will feel more confident. And if you have a learning attitude, you will do much better. So these were the some of the many questions which people have asked. Now, again, how to choose the branch? Well, most people nowadays, in fact everywhere, money and what other students think, that plays a major role on what branch people are choosing. Radiology, 15-20 years before, nobody was choosing radiology, even for that matter skin. Now they are top branches. Top rankers will invariably go for these branches. I understand importance of money. I understand importance, like, you need to show that yes, I'm intelligent because, I've picked up radiology, or I've picked up one of those hi-fi branches. But money and social proof, what others are saying, should not be the sole criteria of deciding which branch you should choose. Let's first talk about money, because ultimately, even we may not express it clearly, but behind every decision in today's life, money is one of the most important factors. Money has become, the default way of our thinking, because we feel money is very important for everything, for happiness, to buy things. So I'll just this is a study done at Harvard in 2010, and they actually tried to measure. It's a huge study. They actually tried to measure, what is the effect. How much money is enough. And I'll not go into a lot of details about this study, but it shows that $75,000 an annum. After that, money has no correlation with happiness. Now, $75,000 per year in America is equivalent to around 12 lakh rupees per annum in India, which is 1 lakh rupees per annum in India. I don't think that any postgraduate student in any specialty will earn less than this. So even though it's very hard to believe, but your happiness, your success, your entire life now is free from that money factor. So don't be too much stressed out. Don't give that which branch will lead to higher salaries, which is the most demanding branch in terms of clinical scenarios. let that not be the sole criteria. So if not that, what should be the sole criteria? I mean, there are chances that to some of you, some branch may speak to you. Like when I worked in casualty, I really had that, yes, this is where I want to work for the rest of my life. One of my friend, I mean, he was so awesomely interested into surgeries. He used to do, as an intern, he used to do venous cut opens, he used to do surgeries, he used to assist in it. But when he got a rank and he was getting pediatrics, all of the students around said, oh, come on, you are getting pediatrics. Why are you taking surgery? He took pediatrics and he felt terrible after that. He still curses that he did not take surgery. So, if that's the case, if any branch speaks to you, right, go for that branch. No matter, even if it's anatomy, even if it's biochemistry. If the branch speaks to you, listen to your heart, and there's no dearth of money on any branch. In fact, money should not be a criteria. So, but for most of us, I mean, 10-15% of the people may have that interest into a branch. But for most of us, branch would not. We don't have any inclination to any branch. Most of us. So in that case, just look at your personality type. Are you very academic oriented? You like reading books, keeping yourself updated, learning tables, seeing flowcharts, diagrams? Then probably medical branches would be more suitable to you, because those branches require a lot of keeping yourself up to date on various topics. Again, if you're very sporty, outgoing, not too bookish, you don't like to read a lot, but you're good, you're intelligent. So you may think of surgical branches, because surgical branches, it's more skill oriented. You know certain things, you practice it well, and you do very well. So how much do you like patient interaction or interest in surgery? I mean, things like those. If you are not very keen on patient interaction, paraclinical, preclinical branches may be great. If you have a lots of interest in surgery, go for surgical branches. And most importantly, I mean, how do you see yourself 10 years from now? How do you want to maintain a work-life balance? I mean, most of the girls would like to go for obs gynae, because that's the thing they should be doing. That's the way they think. That's the place where a lot of doctors are making money. But they don't think about work-life balance. They don't think that, okay, as an obs gynae specialist, they have to put in a lot of hard work. They would have to sacrifice a lot of work-life balance. So, these things should start playing, understanding yourself and then making a choice. Best way to judge, according to me, would be doing internship. What was your experience in a department? When you were working in a department, how did you feel? Try to recollect it. Or talk to as many seniors as possible. See them at work and see that, would you like yourself to be in their shoes? If yes, I mean, those are the branches you would like to look at. I would like to close. I mean, it's a very critical juncture for you. You are asked to make a decision which branch to choose. And as I always say, there are two decisions which stay for lifelong. The person you decide to marry, I mean, he or she, that's one of the most critical decisions of your life. And the job which you want to do. If you get these two decisions correct in your life will be the most awesome experience. Any of these two decisions go wrong, you will regret it for the rest. So, for academics, I can tell you, if you choose the right branch, only one thing you have to do. You have to dedicate yourself to a lifetime of learning. I've seen many clinicians, as they get into practice, they do read, but it's not about really learning. You have to invest at least 1 to 2 hours a day into learning, and then you will excel in whichever specialty you choose. And it will not depend on whether you are a degree holder, diploma holder, or whether you are from a government college, you are a private college, so nothing will matter as long as you are investing in learning. In fact, most of the people, I mean, big companies have been opened up by people who were school dropouts, college dropouts. Hope this video would help you in some way or other. Thank you.